Let me ask you something. This morning, did you have a glass of orange juice? Maybe some whole grain toast? Perhaps you grabbed a heart-healthy granola bar on your way out the door. If you answered yes to any of those, stay with me. Because what I'm about to tell you directly contradicts what the food industry has been telling you for 30 years. I'm not here to alarm you. I'm here because after spending years working in clinical medicine and reviewing the research on cardiovascular disease, I kept seeing the same pattern over and over again. Patients coming in, people in their 40s, their 50s, doing everything right by conventional standards, eating healthy, managing their numbers, and still showing up with arterial inflammation, still showing up with damaged endothelial tissue, still ending up in emergency rooms. And when I looked at their diets, really looked, I found the same foods appearing again and again. Today I'm going to walk you through 7 specific foods that silently damage your cardiovascular system after 40. Not because they taste bad, not because they're obvious junk food, because after 40, your body processes these foods completely differently than it did in your 20s. And nobody is telling you that. We're going to go through all 7. Number 7 is bad. Number 4 is going to surprise you. But number one is the one I see on nearly every single plate of every patient who comes to me with cardiovascular concerns. And it's probably in your kitchen right now. Stay with me through the full list. This one's important. Before we get into the list, I want to acknowledge something. If you're over 40 and you're paying attention to your heart health, you've probably been told 100 different things by 100 different sources. Eat less fat. No, wait, eat more fat. Avoid eggs. Actually, eggs are fine, take a statin. Don't take a statin. The contradictions are exhausting. And the result is that a lot of people just give up and go back to eating whatever's convenient. I understand that. But here's what I want you to understand. The confusion isn't an accident. A lot of nutritional guidance has been shaped by industries that profit from keeping you on a specific dietary path, regardless of what the underlying science shows. What I'm giving you today comes from the cellular level up, not from food pyramid charts, not from industry-sponsored guidelines. We're going to talk about what actually happens inside your arterial walls, your endothelium, your inflammatory pathways, when these 7 foods enter your bloodstream after 40. Because when you understand the mechanism, you stop guessing. You stop following conflicting advice. You start making decisions based on what your body is actually doing. That's the goal today. Not fear, understanding. Here's the foundational concept you need before we go through the list. Running along the inside of every single one of your blood vessels is a single layer of cells called the endothelium. This tissue is only 1 cell thick, but it does an extraordinary number of jobs. It regulates blood clotting. It controls how much your blood vessels dilate or constrict. It produces nitric oxide, the molecule responsible for keeping your arteries flexible and blood flowing smoothly. And critically, it acts as a barrier against the inflammatory processes that lead to plaque buildup. When your endothelium is healthy, your cardiovascular system is flexible, responsive, and clean. When it's chronically inflamed and damaged, that's when the real danger begins. Now here's the crucial part. And this is what changes everything after 40. In your 20s and 30s, your body has a remarkable capacity to repair endothelial damage. Antioxidant systems are strong. Nitric oxide production is robust. Inflammation is resolved quickly. But after 40, that repair capacity begins to slow. Nitric oxide synthesis declines. The endothelium becomes more vulnerable to the oxidative stress caused by certain foods. And the inflammatory response, once it's triggered, takes much longer to resolve. This means a food that was relatively harmless at 30 can begin causing measurable endothelial damage at 45. Same food, different body. Keep this framework in mind as we go through the list. Every single one of these 7 foods acts on this system, just through slightly different mechanisms. Let's start at number 7. Number 7, processed fruit juices. I want to start here because this is the one that gets the most pushback. And I understand why. You've been told your whole life that fruit juice is healthy. Vitamin C, antioxidants, natural sugars. Here's what actually happens when you drink a glass of commercial orange juice. Within 30 minutes, your blood glucose spikes sharply, far more than if you had eaten the whole fruit. Why? Because the fiber has been removed. Fiber is what regulates how quickly fructose enters your bloodstream. Without it, you get a concentrated fructose hit that your liver has to process rapidly. And here's the endothelial connection. That rapid fructose metabolism in the liver drives a process called de novo lipogenesis, the conversion of sugar to fat. This elevates triglycerides, which are directly toxic to endothelial cells. High circulating triglycerides are one of the most underappreciated cardiovascular risk factors in adults over 40. There's also the question of what happens to commercial juice during processing. Most juice is stored in oxygen-depleted tanks for up to 12 months before packaging, a process that strips the naturally occurring flavonoids that gave the juice its health properties in the first place. Pro tip: if you want the cardiovascular benefits of fruit, eat the whole fruit, especially citrus. The white pith underneath the skin is where the most potent flavonoids concentrate. Don't peel too aggressively. Number 6. Refined vegetable and seed oils. Canola oil, sunflower oil, soybean oil, corn oil. These have been the dietary backbone of healthy cooking for the last 50 years. If you've been cooking with these, your doctor has probably never told you to stop. But there's a specific biochemical problem that develops with age, and these oils are at the center of it. Your body requires a precise balance between omega-6 and omega-3 fatty acids to regulate inflammation. In ancestral diets, this ratio was roughly 4-1. In the modern Western diet, it runs between 15-1 and 20-1, almost entirely because of seed oil consumption. Omega-6 fatty acids, particularly linoleic acid, which dominates these oils, are the raw material for pro-inflammatory compounds called prostaglandins and leukotrienes. When you chronically overconsume them, your body is essentially in a state of low-grade systemic inflammation. Even when you're not sick, that chronic background inflammation is one of the primary drivers of endothelial damage. There is also a heat stability problem. When these polyunsaturated oils are heated to cooking temperatures, they oxidize and form compounds called aldehydes and advanced lipid oxidation products. These compounds are directly cytotoxic, toxic to cells, including the cells lining your arterial walls. Pro tip: for cooking at high heat, extra virgin olive oil and avocado oil are far more stable. Olive oil's primary fat, oleic acid, is monounsaturated and highly resistant to oxidation. Look for cold-pressed or first-press labeling, which indicates lower initial oxidation before it ever reaches your pan. Number 5. Low-fat dairy products. Stay with me on this one because I know it goes against everything you were told in the 90s. The low-fat dairy recommendation was driven by a simple hypothesis. Saturated fat raises LDL cholesterol. High LDL causes heart disease. Therefore, reducing fat reduces risk. That hypothesis has been substantially complicated by the research of the last 2 decades. Here's what the low-fat processing actually does. When fat is removed from dairy, 2 things happen. First, the fat-soluble vitamins, particularly vitamin K2, are removed along with it. K2 is critically important after 40 because it activates a protein called matrix GLA protein, which prevents calcium from depositing in arterial walls instead of in bone. Without adequate K2, calcium arterial calcification risk increases. This is a direct cardiovascular risk factor, independent of cholesterol. Second, low-fat dairy products compensate for the lost palatability of fat by adding sugar, sometimes in significant quantities. A single serving of low-fat flavored yogurt can contain as much sugar as a small chocolate bar. That sugar load drives exactly the kind of triglyceride elevation and endothelial stress we discussed with fruit juice. The fat was not the enemy. In many cases, removing the fat while adding sugar made the product significantly worse for your cardiovascular system. Pro tip: if you tolerate dairy, full-fat fermented options like plain Greek yogurt or aged cheese retain K2 and have a far lower glycemic impact. The fermentation process also produces short-chain fatty acids that have independent anti-inflammatory effects in the gut. Number 4. Whole grain bread and healthy cereals. This is the one most people don't want to hear, and I completely understand why, because whole grain products have been the gold standard of heart health messaging for decades. But I want you to look at this from a glycemic biology standpoint, not a marketing standpoint. The glycemic index of 2 slices of whole wheat bread is approximately 71. White bread is 75. They are nearly identical in terms of how rapidly they elevate your blood glucose. The fiber in commercial whole grain bread is present, but often in insufficient quantity, and the wrong physical structure to meaningfully slow glucose absorption. Much of the grain has been milled to a fine flour regardless of whether it began as whole grain, and fine particle size is what drives rapid glucose release. After 40, there is a process called postprandial hyperglycemia, the blood glucose spike that occurs after meals, that becomes an increasing cardiovascular risk factor. Each glucose spike triggers a release of reactive oxygen species that directly damage endothelial cells. Research has shown that endothelial damage from a blood glucose spike can be detected within hours of a single meal. And there is a second issue specific to many commercial cereals and breads. They are frequently enriched with synthetic B vitamins to replace what was lost during processing. Synthetic folic acid, the enriched form of folate, has been shown in some research to interfere with folate metabolism in people who carry common gene variants. Impaired folate metabolism elevates homocysteine, which is an independent cardiovascular risk factor that damages arterial walls through a completely different pathway. Pro tip: if you want the genuine fiber and micronutrient benefits of grains without the glycemic spike, opt for whole, intact grains. Oats that are steel-cut rather than rolled, or sourdough bread where long fermentation has substantially pre-digested the starch. The longer the fermentation, the lower the effective glycemic load. Number 3. Processed deli meats and cured foods. Turkey slices, packaged ham, chicken cold cuts marketed as lean, low-fat, high-protein. These are a lunchtime staple for millions of people who are actively trying to eat well. The problem here is specific. It's not primarily about saturated fat, and it's not about sodium alone, though sodium matters. It's about a class of compounds called nitrosamines. Commercial cured and processed meats use sodium nitrate and sodium nitrite as preservatives. In the packaging, these are stable. But when they enter the human digestive tract, particularly in the presence of the protein fragments in processed meat, they undergo a conversion to N-nitrosamines. This process is significantly accelerated by heat, which is why reheated processed meats are a particular concern. Nitrosamines are potent oxidizing agents. They damage endothelial tissue, promote arterial inflammation, and interfere with nitric oxide signaling, the same system responsible for keeping your blood vessels flexible. There is also evidence connecting chronic nitrosamine exposure to mitochondrial dysfunction in cardiac muscle cells themselves. Pro tip: when selecting cured or preserved meats, look specifically for labels that say uncured or no added nitrates or nitrites. These products use celery powder or other vegetable-derived sources instead, which, while still containing some naturally occurring nitrates, arrive with co-present antioxidants like vitamin C that substantially inhibit nitrosamine formation in the gut. Number 2. Refined sugar and high fructose sweeteners. Most people know refined sugar is problematic. What most people do not know is the specific mechanism through which it accelerates cardiovascular aging, particularly after 40. The process is called glycation. When excess glucose circulates in your bloodstream, it bonds non-enzymatically to proteins, including proteins in your arterial walls. This creates what are called advanced glycation, end products, or AGEs. AGEs stiffen arterial tissue. They cross-link collagen in blood vessel walls, making them less elastic, and they bind to specific receptors on endothelial cells that trigger a sustained inflammatory response. Here is why this matters specifically after 40. Age accumulation is cumulative and largely irreversible through conventional means. The damage compounds over time. Every year of high sugar intake adds to this burden. And because the repair system's slow after 40, the net accumulation accelerates precisely when you least want it to. High fructose corn syrup, which appears in a remarkable number of packaged foods, including things labeled as savory, is particularly problematic because fructose bypasses the normal glucose regulation pathway and goes directly to the liver, where it drives triglyceride synthesis even more aggressively than glucose does. Hidden sugar is the real issue. Savory sauces, salad dressings, bread, flavored waters, protein bars. These are often substantial sugar sources that people don't account for because they don't taste sweet. Pro tip: scan ingredient labels for any of these aliases: maltose, dextrose, sucrose, evaporated cane juice, fruit juice concentrate, maltodextrin, and corn syrup solids. These are all functionally equivalent to refined sugar from a glycation standpoint. A product can have 4 or 5 of these and still say no added sugar if the threshold is calculated per individual ingredient. Before I give you number 1, I want to ask you something. Where in the world are you watching this from? Drop your city or country in the comments right now. I read every single one, and I'm always amazed by how far this community reaches. And if you're watching this because a family member or friend sent it to you, leave a comment telling me what brought you here. All right. Number 1. Ultra-processed convenience foods. I want to be precise here, because some people hear ultra-processed food and assume I'm talking about obvious junk. Fast food, chips, candy bars. I am not just talking about those. I am talking about a category that includes foods actively marketed as healthy. Protein bars, low-calorie frozen meals, plant-based meat alternatives, fat-free snack packs, diet biscuits, meal replacement shakes. All of them are produced through industrial processes with ingredients that are not found in domestic cooking. And the specific concern here is a class of fats that has evolved since the partial hydrogenation ban, intrasterified fats. When partially hydrogenated trans fats were phased out, the food industry needed a replacement that provided the same texture and shelf life stability. Intrasterified fats were the answer. These are created by chemically restructuring the position of fatty acids on the glycerol backbone of fat molecules, producing a fat with industrial stability but a biological behavior that is not well understood. Early research is concerning. Intrasterified fats appear to increase LDL particle density, shifting LDL cholesterol toward the small, dense LDL subtype, which is significantly more atherosclerotic than large, buoyant LDL. Small, dense LDL particles are smaller than the gaps in endothelial cells, allowing them to penetrate arterial walls and initiate plaque formation more readily. But the deeper issue with ultra-processed foods as a category is systemic. They are high in refined carbohydrates. They contain multiple sources of hidden sugar under different names. They contain industrial seed oils. They are intentionally designed to override your satiety signals, meaning you eat more than your body needs, driving chronic caloric excess and the metabolic inflammation that accompanies it. A major study following over 100,000 adults found that each 10% increase in ultra-processed food intake was associated with a significant increase in overall cardiovascular disease risk, independent of every other dietary factor measured. The number one risk factor is not any single ingredient. It is the cumulative daily exposure to foods engineered for palatability and shelf life at the expense of your endothelial health. Pro tip: the most reliable shortcut to identifying ultra-processed food: count the ingredients. If a product has more than 5 ingredients, and some of those ingredients are not things you could purchase at a grocery store yourself, emulsifiers, modified starches, flavor enhancers, stabilizers, it is almost certainly ultra-processed. The 5-ingredient rule is not perfect, but it will eliminate the vast majority of the problematic category without requiring you to memorize a food science textbook. So we've been through all 7, and I want to give you something more useful than just a list of things to avoid. Here is what I call the endothelial reset protocol. 3 specific actionable changes you can make this week that directly counter the damage pathways we've discussed. Step 1. The nitric oxide reset. Nitric oxide is your endothelium's primary repair and protection molecule, and there are specific foods that dramatically upregulate its production. Dark leafy greens, particularly rocket, spinach, and beetroot, are high in dietary nitrates that your oral bacteria convert to nitric oxide precursors. Add a handful of rocket or baby spinach to 1 meal per day. Add 200 ml of plain beetroot juice 3 to 4 times per week. These 2 changes alone have been shown in peer-reviewed trials to measurably improve endothelial function within 2 weeks. Step 2. The omega rebalance. The goal is to shift your omega-6 to omega-3 ratio back toward the 4-to-1 range your inflammatory pathways were designed for. Replace your cooking oil with extra virgin olive oil or avocado oil immediately. Then add 2 servings of fatty fish per week. Sardines and mackerel are the most bioavailable sources of EPA and DHA, and among the lowest in mercury. If you supplement, choose a triglyceride form fish oil rather than ethyl ester form. The triglyceride form has approximately 70% better absorption. A dose of 2 to 3 grams of combined EPA and DHA per day is what the research supports for measurable cardiovascular benefit. Step 3. The glycation break. The most powerful intervention for reducing postprandial glucose spikes, and therefore slowing age accumulation, is not cutting all carbohydrates. It is managing the sequence and composition of your meals. Research has shown that eating fiber and protein before carbohydrates in the same meal reduces the postprandial glucose response by up to 73%. Start your meal with vegetables or a protein source. Eat any carbohydrates last. This one change requires no dietary restriction, just reordering what you already eat. Additionally, a 10-minute walk after meals has been shown to reduce post-meal glucose by a comparable magnitude. Not exercise, just walking. 10 minutes. The muscle contraction activates glucose transporters in your cells independently of insulin, clearing glucose from the bloodstream before it can initiate glycation. Here's the thing I want you to walk away with today. Managing heart health after 40 is not about restriction. It's not about counting every calorie or avoiding every pleasure. It's about understanding which specific foods are working against your endothelium and making targeted swaps that give that system a chance to do what it was designed to do. The research is clear. Endothelial function can be meaningfully improved at any age. The biology is not fixed. Your arteries are not a one-way countdown. Given the right inputs, the repair mechanisms, even slowed, can produce measurable change. That is not optimism. That is what the clinical literature shows. If you found this useful, share it with someone you care about who is over 40. Not because it will alarm them, but because understanding this gives them options they may not know they have. I'll see you in the next one.